Hey boomers, Marcia here with homehealthpt.com. If you've ever had a knee or hip surgery, or any leg surgery for that matter, you've probably been sent home with the requirement as one of your home exercises to do quad sets. Quad sets are glossed over a lot by many people because they just don't think they're important, because sometimes they seem too easy, other times they're just way too painful to do, and they just seem so trivial in your rehab process. I'm going to show you how to do quad sets and explain to you how you can modify your quad set so that you can actually do them correctly, because quad sets, like any exercise that ends in the word set, is an isometric exercise. This helps to strengthen that muscle so that you can actually walk again, because that muscle's got to be strong enough to support your weight. So I'm going to show you a few things. Let's get started. The quad muscle is your thigh muscle right here on top of your leg. Anytime you've had knee or hip surgery, you've got a muscle there that stabilizes the knee or the hip. A lot of times quad sets are a simple but yet very painful and complicated exercise that the doctor wants a lot of patients to do. You want to make sure that your doctor wants you to do this exercise to begin with. I'm going to show you a few pointers on how to do it comfortably. A quad set basically is tightening this muscle on the top of your leg, your thigh muscle, tightening it and pushing your knee down in the table. So really, if you just think about pushing your knee down in the table or the bed or the floor, wherever you're laying, even in the recliner, by doing that, you're actually tightening your quad muscle. Okay? Sometimes after physical therapy, or before physical therapy, sometimes after surgery, this muscle is really reluctant to kick back in and do its job. So one tip that you can do to get that muscle kicking in is to tap it. That kind of lets the muscle know that you want that muscle right there to kick in. Kind of helps bring him back from its lunch break, so to speak. At any rate, you want a strong quad muscle to be able to support your knee or your hip, depending on what kind of surgery you've had. Now sometimes, especially with a total knee replacement, you come home and your knee is clear up in the air like this because it's too painful to extend it all the way down. No problems. Now, I know your doctor and your physical therapist might have told you not to sleep with a pillow under your knee, not to do any exercises with pillows or anything under your knee. I'm here to tell you that you can. Protocols out there are generally just protocols. They don't really address each person in particular. And your pain level may be way more than the next door neighbor's pain level. So one way that you can modify the quad set and make it doable is to take a dish towel. Nice thing about a dish towel is that you can fold it or roll it to any height that you want. And if that's not high enough, you can always use a small pillow, or a big pillow for that matter. You got to start where you can start. What you're going to do is you're going to stick that towel right under the bend of your knee. Just support your knee. That way, two advantages. Your knee is supported, and your knee has something to push against when you push down in towards the table. So now when I do a quad set, I'm a little bit more, probably a lot more willing to do that quad set, simply because my knee is supported and my body's not trying to figure out if it should brace or guard from injury. Another thing that you need to remember about a quad set is that you want to hold that contraction for 8 to 10 seconds. That is part of the strengthening advantage of doing an isometric exercise. And again, this muscle here stabilizes the knee, and the knee has to be stabilized for the hip to work well, and vice versa. They all work together as a team. So you want to hold that isometric contraction. You want to do this exercise slow and controlled, so don't want to be jerky about it, okay, but just nice and slow and controlled. Okay, modify the exercise for you. And what I would recommend is working yourself up to be able to do between 10 and 20 of these exercises. Now here's the catch. Number one, modify the exercise. And number two, quality always before quantity. What I mean by that is that if you start falling apart after you've done, say, 6 quad sets, you've done 6. Great. Move on to your next exercise. If you start falling apart after you've done 12, don't get a number stuck in your mind. Have an overall number that you're working towards. But you'll find that one day you'll be doing great, and the next day you might not feel so great, and all your exercises may not go over so well. So don't be afraid to just work with your body. Listen to your body. Don't push yourself to greater than a 4/10 on the pain scale. That 4/10 is about an uncomfortable. You may already be at a 4/10, so just don't make it worse. Make sure that your doctor wants you to do quad sets. Always put an ice pack in a pillowcase, wrap it around your knee or your hip, wherever you've had surgery. Sometimes even an ankle surgery requires a quad set to keep your legs strong. So use that ice there for 15 to 20 minutes, but never put ice directly on your skin. Quality over quantity, can't emphasize that enough. As you work on quad sets, you'll start to gain your strength back to be able to do short arc quads and actually straight leg raises. We'll talk about them later. But you'll also reap the advantage of getting full range of motion. So as you get better, start to take the towel out or simply bump it down a little bit. That's a little shorter than I just had it. And then you can bump it down a little bit more. So as you're able to get rid of that towel and just gently push right down into the bed or the floor of the table, wherever you're at, that's going to help you get this extension into your knee. And when you walk, your knee at some point in time in that gait pattern needs to be able to fully extend for everything to be working smoothly as a team. That's it for today. More tips at homehealthpt.com. Thanks for joining me.